Welcome back to the channel. There's a lot of misconceptions about epilepsy and how it affects people. Some people think it's just a disease that makes you have seizures, while others believe it's a mental illness. So today we are gonna set the record straight and tell you everything you need to know about epilepsy. Epilepsy is a neurological disorder that causes you to have repeated seizures over time. But what exactly is a seizure? Well, it's a sudden, uncontrolled electrical activity in the brain. When this happens, it can cause changes in your behavior, movements, or feelings. Some seizures can be small, like a twitch of the eyelid, while others can be large, like a convulsion. But why does this happen? Well, it all has to do with your brain cells. You see, your brain cells communicate with each other through electrical signals. When these signals get messed up, it can cause a seizure. In some cases, we don't know exactly what causes the signals to get messed up, but in other cases, we do. Some common causes include head injuries, stroke, brain tumor, and infection. So once you have one seizure, do you automatically have epilepsy? Not necessarily. To be diagnosed with epilepsy, you need to have more than one seizure. But even if you only have one seizure, it's still important to see a doctor to rule out any underlying causes. What are some of the other symptoms of epilepsy? Well, before a seizure, you may feel a strange sensation, like a déjà vu or a weird taste in your mouth. You may also have a warning sign, like a flashing light or a funny smell. These are called auras. Not everyone with epilepsy experiences them, but they can be an important part of a seizure. What triggers a seizure? Well, anything that causes stress to the brain can trigger a seizure. This can include flashing lights, loud noises, certain smells, or even a simple change in routine. It's important to keep a seizure log so you can identify any patterns and triggers. This can help you take steps to avoid seizures and keep you safe. Can epilepsy be cured? Unfortunately, there is no cure for epilepsy, but there are treatments that can help control seizures. Medications are the most common treatment for epilepsy, and in some cases, surgery can be an option. Living with epilepsy can be challenging, but there are resources available to help you. The Epilepsy Foundation is a great place to start. They have a ton of information on their website, and they also offer support groups and other resources. We hope this video has helped you learn more about epilepsy. Remember, you're not alone. There are resources available to help you, and there is hope for a cure. Thanks for watching and take care.